Okay, so this is the inside of your shoulder from June the 3rd, 2014. And you can see that this is the labrum at the top called the superior labrum. There's a little bit of fraying here. The anchor itself looks nice and attached there. This is your biceps tendon coming off of the superior labrum. Looks nice and smooth. A little bit of inflammation, a little bit of fraying of your rotator cuff right there. I'll debride in a second. But this is the front tendon of the rotator cuff called the subscap, and you can see it's nice and normal. A little bit of synovitis right there around it, but there's no tearing. This is your supraspinatus attachment, and again, very slight fraying at the front, but most of the attachment onto the side of the articular surface looks normal. Sometimes you can see some of the calcium bulging on this side, but I don't see anything obvious there. And then I'm coming around the back of your humeral head. Attachment looks nice. Normal bare area on the humerus, normal inferior capsule, and normal posterior labrum. This is kind of what we were expecting to find in the joint. Okay. So like I said, I'm just going to debride that labrum a little bit at the front. We'll take the shaver. So two things to point out here, Roger. Magnification, number one. Every one of these calibrations on the tip of the shaving instrument, 2 millimeters. So you can see that the viewing area here is just a little over a centimeter. So there is a lot of magnification, so don't get alarmed by how big things seem to appear on the image of your shoulder. And so I'll just clean some of that up. There we go. And I'll take the ablator here right away. The second thing is, you just saw a little bubble right there, is we inflate your shoulder full of water to accomplish this procedure. So from time to time you may get the appearance that there's fluid moving, and that's why. Okay, so just use this ablator to smooth things out a little bit. So this is the anterior labrum. I'm just debriding there. Superior labrum. Okay. And then your biceps, like I said earlier, a little bit of tendinitis where it exits. Okay. Most part looks good. All right, so we're going to go into that space over top of the rotator cuff now, and look at your rotator cuff from the other side, that calcium deposit, and do the decompression. Okay? Be back in a sec. Okay, so this is now the space over top of your rotator cuff, and this is the undersurface of the shoulder blade. You can see that there is some fraying and inflammation here, so we are, kind of going to have to release all of these tissues. And then when we get this all released, then we'll show you the undersurface of the shoulder blade a little better. So what we do initially is just kind of expose all this, release this ligament. Below us is the rotator cuff. And that's likely that calcified area right down in there. So I'll get this all released, and then when we're done, show you how it looks just before we do the decompression. Okay? So it's just a matter of just exposing all of this undersurface of the shoulder blade back and forth and lateral. Okay? We'll be back in a sec. Okay, so this is after we've cleared up that bones or undersurface of the acromion. We've released the coracoacromial ligament. There you can see the front edge. There's a little bit of debris we got to take away. So this burr is 6 millimeters. And so what we're going to do is we just start shaving away some of this bone underneath the acromion, a little bit of that bone spur. We're doing that decompression that we talked about. Again, to point out the magnification, this burr tip is 6 millimeters. Just slow it down and stop it for you. So this is 6 millimeters. It looks huge. And what we do is we want to shave away some of this front edge of the acromion before we get down looking at the rotator cuff here. Okay? There's the calcium right there. You can see it. We'll come back to that in a sec. But we do the decompression first, just shaving away some of this bone to make the space bigger, and then I'll show you when I get into that tendon inspection and removal of calcium. Okay? Okay, so we've shaved away that bone underneath the shoulder blade. So now we've got a decompression done underneath the acromion. This is the bursal side of your rotator cuff right there, and you can see some fraying, but what I'm looking at right here is this big blob of calcium. How do I know that? Well, you can see I stuck that spinal needle in, and you can see that calcium starting to come out. So we'll just create our little bit of a rent there. And now we'll take the shaver and hopefully see some success here shortly. Oh, look at this. This is what I'm talking about. Okay. Okay. So I don't know if this is going to be YouTube worthy, but don't worry, we're just getting started. Look at that. Yep, that's exactly what it is. It's like toothpaste. The inflammation process that's gone south. Instead of going through the normal kind of healing capacity, it creates this chronic kind of inflammation and calcification, and that in turn sometimes will create these huge blobs, which he's got here. So we got to be careful. Oh yeah, there's more. No, we're not done yet. There you can see it coming. Some in there as well.
Now, how did you know those were there? Like how?
You can see them on X-ray.
Oh, you can?
Yeah.
Okay.
So there you can see all this calcium in that tendon getting all milked out here. I'm getting close now here, and just want to make sure that we've gotten most of that. And then you want to leave the edges, so, and sometimes we need to put a stitch in here. We'll see what it looks like here at the end, but we want to create a surface that can allow it to heal. Okay, so I think I'm going to put one stitch in here, which will just kind of slow you down in terms of active lifting for a couple of weeks, but other than that, everything looks good. So that's removing your calcium, and looks a lot better now and flatter. Okay, so I'll just move his arm, but looks like I put a little one side-to-side stitch in that gap, so I'll just need the hi-fi. Okay, all right, I'll be back in a second when I'm putting that stitch in. Okay, you see now I've passed a stitch through this rent from front to back, and suture tube. So now I just want to, this is a side-to-side stitch, a suture retriever. You don't have?
You want the upper panel then?
Okay, well, let's see if I can get it with a probe. Sorry, I'm just improvising here a little bit. Make sure that my stitches are coming through the same hole before I start tying. Okay, you hold that. So there. Now as you see, as I go to tie this, it will pull this rent. Okay, I've got to show them the rent here. Right there. You can see that rent. As I pull this together, it will close that off. Okay? Give me the snap. Okay, so that's my front one. So I tie a knot outside the skin. This is all still microscopic. Okay. Knot pusher will be next. So there you'll see the knot coming in here right away. There you go. So, should close that defect up. Okay? You can see there's no slit there anymore. Okay? Knot pusher. So then I just tie a couple of throws in addition once I get this set. Externally rotate a little bit. Band it, there we go. Okay. You guys have a suture cutter?
There's scissors.
Okay, so there you go. So that's that knot.
Scissors.
Good. Okay, suture cutter.
Scissors.
All right, so that's pretty much it. You see, we've closed up that cuff rent, removed the calcium. So sling, like I said, for a couple weeks, and then we'll get going, get in your range of motion. So that's pretty much it. Take care. We'll see you in a few weeks.